Hi there, our highly valued, treasured and esteemed viewers and listeners, and welcome back to your channel of choice. This video I am about to present was compiled by Dr. Nath Arua, a clinical pharmacist by training and profession who is the founder of Progressive Pharmacotherapy Consultants, the premier virtual clinical pharmacy institute for capacity building for healthcare workers. The Virtual Clinical Pharmacy Institute with a difference, where patient safety, medication therapy management and optimal clinical outcomes are very crucial and non-negotiable to us. Here we seek to remain your premier source of crucial tips for high-impact pharmacotherapy services. So, on behalf of the Institute, I humbly urge you all to sit back and spare me part of your very precious time to share with you very useful tips which may prove very, very handy in your line of duty. I now welcome you all to part 536 of our pharmacotherapy series, which majors in anxiety disorders. The first case reads, TSH, an 18-year-old man, is brought for psychiatric consultation by his mother, who complains her son is extremely shy and she's concerned about his ability to fit in at college. TSH was referred to the psychiatrist by his primary care physician, who reports TSH is physically healthy. TSH's mother states he is a very bright young man who made straight A's in high school despite frequent absenteeism. He only has one close friend and has never been on a date. TSH's mother says during high school, TSH rarely attended school social functions and spent much of his time in his room working on his computer. On graduation from high school, he received a full scholarship to a community college, but is quite anxious about going and is debating whether he should turn down the scholarship. When questioned by the psychiatrist, TSH's face turns bright red, and his voice shakes when he speaks. TSH admits his behavior is not normal, but says he is afraid he might do something stupid when he is around people and becomes extremely embarrassed when he has to talk to anyone. He has wanted to ask a certain girl on a date for 3 years, but experienced severe anxiety attacks on the few occasions he tried to approach her. TSH is afraid of being turned down and believes no girl would ever want to date someone like him. The psychiatrist's diagnosis is social anxiety disorder. What clinical features of social anxiety disorder are present in TSH? TSH exhibits many characteristic features of the generalized type of social anxiety disorder. TSH admits he does not like being around people for fear of embarrassment, and he generally avoids social situations, which are classic traits of social anxiety disorder. Symptoms of blushing and shaking voice are also common in social anxiety disorder, as well as other typical anxiety symptoms such as palpitations, trembling, sweating, tense muscles, dry throat, hot or cold sensations, and a sinking feeling in the stomach. TSH also displays hypersensitivity to rejection and low self-esteem, and he realizes his behavior and fears are unreasonable. These symptoms and TSH's young age are consistent with a diagnosis of social anxiety disorder. TSH's case illustrates the substantial disability that can result from this illness. TSH's anxiety disorder has deprived him of normal social development, making friends, dating, participating in social functions regularly, and pursuit of higher education. Future impairments throughout TSH's life are likely to be significant unless his anxiety is treated successfully. The physician decides to initiate sertraline 50 mg every morning for TSH. Is the prescribed pharmacotherapy appropriate in this case? Because TSH's generalized social anxiety disorder is severely affecting his life, medication treatment is indicated. Selective serotonin reuptake inhibitors are first-line therapy for treating social anxiety disorder, and sertraline is a good choice because it is FDA approved for this indication and available as a generic. Although not applicable in this case, sertraline is also effective for many other psychiatric disorders commonly seen in patients with social anxiety disorder. The sertraline starting dose of 50 mg per day is appropriate for TSH, and 50 mg increment dosage increases can be made every 4 weeks according to response, up to a maximum of 200 mg per day. Signs of response may be seen within 2 to 4 weeks, but 8 to 12 weeks is usually required for optimal results. If available, cognitive behavioral therapy may also be combined with pharmacotherapy for TSH. The next question reads, what are the goals of treatment in this case, and how can TSH's response to treatment be objectively assessed? How long should effective therapy be continued? Three principal domains of treatment outcomes have been defined for social anxiety disorder: symptoms, functionality, and overall well-being. It is recommended that all three of these areas are assessed because even if all anxiety symptoms disappear, treatment is not clinically significant unless functioning also improves. The clinician-rated Liebowitz Social Anxiety Scale and the patient-rated Sheehan Disability Scale can be used for measuring improvements in symptom and functional ability domains, respectively. In TSH's case, the desired outcomes of treatment include reducing fear and avoidance of social situations, enabling him to comfortably interact socially and attend college, and improving his quality of life. Several studies have examined relapse rates after double-blind discontinuation of effective treatment in social anxiety disorder. Long-term studies have shown sertraline, paroxetine, escitalopram, fluvoxamine CR, venlafaxine XR, pregabalin, and clonazepam prevent relapse of social anxiety disorder during continuation treatment. Therefore, pharmacotherapy should be continued for at least 1 year after response. After that time, a gradual medication discontinuation trial may be attempted with vigilant monitoring for signs of relapse. So there you have it, our highly esteemed viewers and listeners. That brings us to the end of this video. If it benefited you in any way, kindly remember to give it a thumbs up, to like it and to share it widely with your peers. Please leave your comments at the bottom, and if you haven't yet done so, I humbly urge you to subscribe to our YouTube channel. I would like to promise you all that the very, very best is yet to come. Thank you very much for viewing this video. On behalf of our senior colleague, Dr. Nath Arua, I sincerely appreciate your partnership, continued support and kind collaboration. We look forward to interacting with you in the next video, which will be part 537.